Dr. Aman Moin here. This is a continuation of the series of the early pregnancy module. Today we will be discussing about the miscarriage. If you find my videos helpful, please like, share and subscribe. Now let's come towards the topic. Whenever you are diagnosing a viable intrauterine pregnancy, you have to do the transvaginal scan. Why you need this one? Because you want to determine the location of the pregnancy, the fetal pole and the heartbeat. Now I have highlighted the word offer because this is one of your exam questions in MRCOG2. They pay attention to these minute details when you have to offer and when you have to consider. Once a patient declines the TVS, then you can consider the transabdominal scan, and you can tell her that if she declines the TVS, you have to tell her the limitations of the transabdominal scan, because in early pregnancy TVS is the better option. Now the other thing, when you can consider the transabdominal scan, if she is having fibroids or ovarian cyst. So when in exam you get a scenario with a woman having a fibroid and ovarian cyst in early pregnancy, you have to consider TVS instead of going for offer TVS. This is very important for your EMQs in MRCOG2. Okay. Now this is important for your counseling, that you have to tell the patient that diagnosis of the miscarriage using one ultrasound cannot be guaranteed to be 100% accurate. Therefore we need a serial ultrasounds. So whenever you are performing an ultrasound to determine the viability of an intrauterine pregnancy, first you have to check for the fetal heartbeat. If the fetal heartbeat is not visible, then you have to go for the crown rump length. And if the CRL is also not there, then you have to take the mean gestational sac diameter. Okay, so this is your step-by-step ultrasound. First you have to check for the heartbeat. If the heartbeat is not there, just measure the CRL. If the CRL is still not there, then you can go for the gestational sac. You already know that first sign of the pregnancy is intrauterine gestational sac. Then if you the other one is the yolk sac. Okay, and then we find the CRL, and within the CRL we find the CRL we call the fetal pole, and within this CRL, if the cardiac activity is there, we say it is a viable intrauterine pregnancy. This slide is very important for your routine practice, also your theory exam and clinical exam, as well as MRCOG2, because if you know this slide, you can manage these patients very easily. So I already told you, first of all we will check the fetal heartbeat. If there is no visible fetal heartbeat, we will measure the crown rump length. This is our priority. So if the crown rump length is less than 7 mm, pay attention to this less than 7 mm. With a transvaginal ultrasound scan and there is no visible heartbeat, then we can perform a second scan after 7 days before making a diagnosis. So whenever you are doing a transvaginal scan, the next scan for the follow-up you have to do after 7 days. This is when the CRL is less than 7 mm. But when the CRL is 7 mm or more than or equal to 7 mm, and there is no visible heartbeat, you can take the second opinion from some other sonologist or a senior obstetrician, or you can perform a second scan minimum 7 days after the previous scan. Here you need to pay attention for a bit, because you will get a question and they will state that the CRL is more than or equal to 7 mm. You will not jump to the diagnosis or the conclusion of the miscarriage, right? You have to still you have to perform another scan after 7 days, even if the CRL is more than or equal to 7 mm. If it is less than 7 mm, we straight away go for a scan in 7 days. But if it is more than or equal to 7 mm, we will not jump towards the diagnosis. Still we have to go for the scan in the 7 days or seek second opinion. So when you get your question like what would be the next step if the CRL is 7 mm or more, the next step would be seek second opinion. But if they ask about what is the best or appropriate, then you have to select the scan in 7 days. Similar is for the transabdominal ultrasound. If you are following a woman with a transabdominal ultrasound, then whenever you do an ultrasound, you have to record the size of the CRL. whenever you are doing a transabdominal scan for a patient, you have to record the size of the CRL. And then perform a second in a minimum of 14 days. Now this time period is changed after the first before making the diagnosis, right? So this is a Konji questions. It is one of the important books for your MRCOG2, that whenever you are doing a transabdominal scan and the CRL, what would be your next step? So your next step would be record the CRL, okay? And then later on you will perform another scan in 14 days. The cutoff will be same, okay? Now once, if you are doing TVS, you check for the heartbeat, you did not find any heartbeat, then you check for the fetal pole or CRL, still nothing was visible there. Then the other thing what you have to do, you have to check the mean gestational sac. For gestational sac, the cutoff is 25 mm. For CRL, it was 7 mm. Whenever it is less than 7 mm and you cannot see any visible fetal pole, right? Because there we were talking about the heartbeat because the fetal pole was there. But now here we will be talking about the visible fetal pole. Then you have to perform a second scan in 7 days, same as the previous one, because for TVS the gestation is 7 days, for transabdominal the gestation is 14 days. But if the mean sac diameter is 25 mm or more using a transvaginal ultrasound and there is no visible fetal pole, then you have to take the second opinion, because already the cutoff, it has reached the 25 mm, but still you have to perform another ultrasound before making a final diagnosis. And you have to clearly state this to your patient that the LMP is not the reliable method, okay? So we have to do the ultrasound and we have to follow the ultrasound. Now you are doing the transabdominal scan. Because of some reason, either the patient is declining, there are ovarian cysts or fibroids. Then whenever you are doing a transabdominal scan, what is the next step you have to do? You have to record the mean sac diameter. In transvaginal, what you were doing, you were recording the CRL. Here you are recording the mean sac diameter because there is no CRL, no fetal pole, no fetal heartbeat. And the second scan you have to perform after the 14 days if the first scan you did by transabdominal route. So you have to tell your woman or the patient, because this is important in your counseling, that waiting for the repeat scan has no determinantal effects on the outcome of the pregnancy, okay? So you go through these slides 2 3 slides 1 or 2 times, then it would be on your fingertips, and this is very easy, okay? The next video I would be posting from the early pregnancy module would be most likely the nausea vomiting in the pregnancy or gestational trophoblastic disease. Thank you so much for watching.